Well, first of all, I would like to welcome all our friends to this first webinar for the TPC. I hope it won't be the only one. We have something else prepared in our bag, but still we are not going to announce it from now. We will see how it goes. And I want to welcome our newest addition to the TPC and to the group, which is Roanna Maharaj. You all know her, I'm sure. As well, actually, I did not know about her qualifications until I saw her CV. So I was really impressed, and I asked her immediately that if she can help us, if she can join us, which she did without any hesitation. And as well, I want to welcome her on the board because she's the latest and the youngest addition to our board representing the TPC. And maybe now we can start with Roanna.
Thank you, Anton, and thank you for the welcome. So hello, everyone. I hope that you can hear me clearly today. I'm very excited to be able to do this talk about depression and how it affects people with thalassemia. Stella, next slide, please. So I'm pre-warning you, there's a lot of information on these slides, but I will try to do my best to keep it very simple and fun so that it's easy to follow along with. Everyone has some sort of an idea of what depression is, but I wanted to spend some time talking about the relationship it has specifically with thalassemia and focus on things such as how they play off on each other, how the symptoms may overlap sometimes. And then I want to spend some time talking about some possible treatments. So these are some of the objectives that we're going to look at today. And I hope that it resonates with you. So before we get into defining what depression is, let us explore some of the reasons why these psychosocial issues occur in thalassemia. Let's think for a moment about life. Life for every human being is difficult. We have to attend school or work. We have to sit exams, do lots of coursework, meet deadlines, take care of family, ignore the relatives we don't really like so much. And for us to say life is a challenge is a huge understatement. It has its ups and downs. Now add living with thalassemia in the mix and it becomes chaotic. And it's often difficult to find a balance without being completely overwhelmed. Now, as thalassemia is a chronic condition, sometimes it may feel as if it takes over every part of your life. I have been told by patients that they feel that they just live to get blood rather than they get blood to live. They say that they're tired of having to take medication all the time, which is understandable. And they can't travel and spend time away from home as long as their friends can. And they're really upset about this. They feel that they're imprisoned and tied to thalassemia. And as a result of feeling frustrated and angry and sad, they stop taking their medication and treatment, their health declines, and then they have they feel more sadness, fear, hopelessness, which causes quite a lot of changes in their behavior and their interaction with others. Another feeling is the feeling of being different or looking different, which then causes things like self-esteem problems. It reduces people's confidence. They begin to then isolate themselves and they think that they're less. They feel that they're less than everybody else, even though they're not. They start labeling themselves. And I have to say, this is something that really, really bothers me because they think that they're less than, they're sick. I've heard people say, well, I have thalassemia, which makes me sick. And it really makes me sad to hear these things. And personally, I think labels should only be used for things like food items and drinks. And the only label I would apply to myself probably is something like peanut butter. but I don't think that labels should be applied to people unless it's their actual name, because it takes away things like their identity and they lose their presence, which then sort of negatively affects their sense of self. So we need to stop this, and we need to stop this now. You're not thalassemic, you have thalassemia. So simple things like that will change how you see yourself. And lastly, a person's financial situation, where they live in the world, they may not have access to proper care and treatment or good doctors. They may not have support. Those are some things that can also cause a huge emotional strain. Next slide, please, Stella. So I don't know if many of you have heard some of these. I have surely heard a lot of them. And they really sort of resonate with me. Now, not only is these comments annoying, but it can trigger things like sadness, anger, hurt, and be very, very helpful to our psychological well-being. Now, let's take an example, like I'll pick this at random. You don't look sick. Now, while this should be taken as a compliment because I don't look like thalassemia, it can cause people to feel like their entire experience of living with thalassemia has been voided. The heartbreak they've experienced, the challenges they've endured have all been discounted by one simple sentence. And that can be very damaging if taken in the wrong context. Now, there are things such as not sleeping well or not exercising, which is really unhealthy for our bodies and exacerbates all those negative thoughts that we have in our mind. You do need to sleep and you do need to exercise because it helps bring endorphins, raise something called neurotransmitters like serotonin, and that gives you the feeling of happiness and joy. So they all link to each other. Stella, next slide, please. So I wanted to talk about the clinical diagnosis criteria for major depression, and this might not be applicable to everybody, but I think it's important to bring this to your attention so that people can see that there's more to depression than being sad. Often you'll hear people say, well, I'm depressed, when what they feel is sadness. So we can't mix the two up. Sadness is a part, but it's not the whole of depression. So according to the BSM, you need 5 or more instances to meet the criteria of major depressive disorder. And I'm sure many of you would have seen this criteria before, whether it be on the internet, in books, leaflets. So you may already be familiar with these. But what it's important to note is that if you feel that you don't meet all of these criteria, like loss of interest, there's a lot more to this, obviously, that I didn't add. But if you feel that you don't meet all of these criteria, but you are still struggling with how you feel, you should talk to someone about it and get treatment that will help you. You wouldn't really ignore a pain in your knee, would you? So then why would you ignore something like feeling sadness that's lasting for a really long time? So there's really no reason not to speak to somebody, and people are willing to listen to you if you talk. And I know often with thalassemia, and I do this, I'm a hypocrite when it comes to this, that people will often ask me, how are you doing? And I'll say, oh, I'm okay, but inside I feel like I'm falling apart. We need to stop this as a culture. And we need to actually say how we feel to people, because they're not going to know, they're not going to learn, and they're going to keep making the same mistakes that trigger sadness in us. Next slide, please, Stella. Often people will try to rationalize how they may be feeling, and they might blame everything on thalassemia. However, something like depression is very complex, and there may be a lot of things going on in your life that are really contributing to depression rather than thalassemia on the whole. I can give you an example of this, and it happens very often. But if someone with thalassemia tells you that they're not happy, I've heard people actually say, well, you're sick, so that's why you're unhappy. And it's really important that we don't do this. We don't discount their feelings of sadness and say, well, of course, you know, you're sick, so this is something that you're always going to feel. It's important to ask why they're sick and get those and listen to those feelings, no matter what they are. And again, I will champion this saying, but you have to ask for help when you need it. Don't sit there and suffer in silence, because one, you can be an advocate for other people who may not know the things that you're going through and may not feel safe to talk about it. So you may inspire people to talk more about what they're feeling, but you will realize that you're not alone in these kind of lonely feelings. And often with people with thalassemia, you know, they think, well, I feel really imprisoned by having thalassemia. I'm tied to it. And even with the diagnosis such as depression, you know, they feel lots of things like guilt, they're ashamed. But what I want to tell you is that you're so much more than having thalassemia, and you must try to ensure that you don't become too absorbed by the condition. Our worlds can become about managing thalassemia. It can be so overwhelmed by managing thalassemia that we forget what we are, what we were before this. So we, you know, managing thalassemia causes us to only think about thalassemia. Our feelings are towards thalassemia. We behave in this way because of thalassemia, and how we interact are all because we're only focusing on thalassemia. And I think it's, you know, you can become so wrapped up with having thalassemia that you forget what your true identity is or who you really are. So when you think about who you are, think about all the aspects of your life. And I'm not giving you permission to say, well, you know, Roanna said not to, I could think about other things. I'm still telling you to take your chelation. There's no kind of mixed messages there. But what I'm telling you is that don't dwell on it. Do your chelation, but then go on and find your hobbies and live your life. And the other 2 points are quite sort of, they're sort of linked. And, you know, often people will compare themselves to others, and they'll say things like, well, my dad has depression, but I don't look like him, so that means I don't have depression. And that's not true. Depression for you can look very differently. It's very unique. And not because you know, somebody acts a certain way and you don't, means that it can't affect you. It can, because it's very specific to you. And it's really about whether there's a decline in how you are now compared to what you were like before, and whether that is causing some sort of significant difficulties in your life. And I don't know if you remember what I showed in the last slide, where one of the criteria was losing interest. This could mean losing interest in the things that you once found joy in. And then suddenly, well, you don't like it anymore, even though it felt like it was a part of you. Those are the kind of things that you need to look at. And you may not feel that you meet any or all of the criteria, but if you do have difficult feelings, I encourage you to seek help and don't try to ignore the feelings at any point. The last 2 points, so it is not a one-size-fits-all policy, and treatment should have a holistic approach. There isn't a single treatment that helps. It's not like with thalassemia, you have your blood transfusions, your iron chelation, and you should be fit. With depression, it's slightly different because you have to take into account all the different aspects of this, depression and the different triggers for it. So we'll come to that in the next slide. But I've heard people say to me, well, my problem is insomnia. I'm not sleeping well. Why do we have to talk about my relationships? But what they don't realize is how they are all connected. Our minds and our bodies are very connected, and things like suffering insomnia and the effect it has on your overall health and well-being, they're very closely linked. Next slide. So these are some of the main causes of depression, and genetic, it makes up about 40% of the cases because it's hereditary. Now, you don't have to have every, all of these aspects related to you, but you can have one or you can have a combination. It's very unique to you. And with the environment, things like your experiences as a child, the traumas that you went through, your relationships with family, physiological could be things like, well, with your thalassemia, your aches and your pains, chemical imbalances, and kind of mental would be fears, anxiety, and those kind of feelings. So it could be a myriad of many different things. And I've also heard people say to me, well, I have no reason to be sad because I have everything that I want. Well, then maybe in this case, it could be more of a chemical imbalance that's causing it. But unless you explore these options, you won't know why you feel sad exactly. And things like from early childhood can affect you later in your adulthood, and you could have no clue about it until it hits you suddenly. So these things could happen at any point of your life. They're quite normal to happen, and they can influence each other. And suddenly you could have things like work becomes very stressful, your health declines, your ferritin goes up, relationships break down, and suddenly you feel really stressed, depressed, and things from your childhood all combine and puts you off, where you start losing interest, and then suffering a decline in your overall well-being. Next slide. So I wanted to talk about how depression may appear to people at different ages in your time. Some may be similar and some may be very difficult. So in children and adolescents, a lot of children do not usually show depression like what we find in adults. But when they do, you find that they start acting out more than they did previously. You'll notice the child screaming a lot, fighting, disobeying. And in most cases, the child is dealing with some sort of depression or anxiety. These are just a list of some of the other things that you might notice with children that we won't necessarily put with depression, but they can occur. You'll hear children saying that, oh, my tummy is hurting, and they're suffering nausea. But until you sort of ask what's happening to them and then really listen to them, you're not going to know what's wrong. And often children will be, if you ask them and they feel safe to tell you, they will tell you about what's really happening. For children, you don't really prescribe much medication. It's more psychotherapy and trying to understand why they're behaving in the way that they do. But one of the things that I find really helpful is when you normalize talking about how you feel. You create the safe space where you talk about the good things and the bad things so that children understand that it's okay to experience these feelings and they learn how to cope with them. Next slide, please. So again, with late teens and young adults, there's a lot of similarities. There's a lot of new things here, like risk-taking behaviors, substance abuse. Sometimes you won't notice things like grades just like declining. People do keep on top of it, but what you do notice is more about their social interaction. They'll be isolating themselves from their friends, spending more time alone, pulling away from you, avoiding any sort of interaction. That's what we find. Often, there's things like self-esteem issues. So with thalassemia, you tend to be you possibly are like shorter, or you mature less quicker than the average human being. So with that, they start to withdraw. And those are some of the things that we look out for. One of the most helpful things, again, you can do with adolescents and young adults is to listen. Often when we hear that our loved ones are depressed, and I do this, you take it quite personally and you're like, well, I have to fix them. I have to help them. But sometimes it's not about fixing anybody. It's about just listening to them. Because when you try to take that over and help, you stop them from telling you, and they feel that they're not heard. So while it's very helpful to try to fix it, sometimes they just want you to listen, and they want you to acknowledge that they're having a hard time and create a relationship where they feel safe to talk about it and try to learn on how they can cope with the different things that they're experiencing. Next slide, please. So in adults, again, there's a lot of things here, and loneliness, I have to say, is one of the biggest causes of depression. There's a lot of fear of death because, you know, with the older adults, life with thalassemia was very, I would say, shaky, and they didn't know what the future would hold. We didn't have things like the treatment we have now. They didn't have it. So, and they saw their friends died. So now that they're getting older, there's a lot of fear in death. What's coming next? Are there new conditions that are going to be developed? And again, people will start pulling away. They'll start neglecting their self-care or personal hygiene. They'll start missing appointments. They'll start breaking down. Plus, they have the other things of life, like family, trying to worry about their family's well-being, making sure they're well taken care of. But they feel this really strong sense of sadness and anxiety. They suffer from different kinds of pains that are unexplained. These are points that, again, people usually blame these like pain and insomnia on thalassemia, saying I have a condition, but actually it could be things down to depression. So it's something, again, that I would suggest that you do speak to your consultants, and to, if you have psychologists, this is when you need to, because it is quite a novel concept of thinking of what is aging with thalassemia. And it's important that you get the help that you need here. Next slide, please. So the mind and body approach, and as I said before, they do link with each other. And now these emojis may look familiar to you, and I wanted to bring something that I relate to, and this is what I felt. And I can tell you, in one day, I probably have experienced all of these emotions, probably in an hour. And the thing about them is that if you think about them a lot or for too long, they can affect us in a positive way or in a negative way. And that could then affect how you think, how you feel, and how you interact with others. Now, can you think about the range of emotions that you felt today? Can you think about how many different times you were happy? What made you happy? What made you sad? Who annoyed you? That's how much emotions can affect your mood. Next slide. So I found this really interesting when I was doing this. And this tells you about some of the feelings you have and why we have them. So like anger, for example, our bodies, we learned how to do this to fight, to protect ourselves. But what we often don't do is release that anger when we feel it. It's quite okay to feel anger. It's normal. You should feel anger. But it's important to know, okay, well, I was angry about this. Why was I angry about this? And now I have to not be angry about it, because that anger could stay with you for seconds, minutes. Then that can lead to hours, to days, to years. And then that's when you go into a series of kind of depressive thoughts, and it becomes very unhealthy behavior. So, you know, it's really important that we identify when we have these different types of emotions. We can pick out the positives of and keep the positives, I should say, and release the ones that makes us sad. But we have to identify them first, deal with them, and then move on. Next slide, please. So often in depression, in thalassemia, sorry, depression is underdiagnosed. People are usually concerned with their ferritin levels, with their blood transfusion regimes. Am I having enough blood? Is my hemoglobin high enough? That they forget to think about their mental health and their well-being. But the mind and body are all connected, and they can influence each other in some way. Now, you need to have your transfusions. There's no discussion there. You need to take your iron chelation. But the way that your body feels influences your lifestyle. The way that you think influences your lifestyle, and the way that your lifestyle. So let's say if you consume or you eat some kind of bad food, that can affect the way that you feel. So they're all linked in a way. If you don't feel well, you won't want to go outside and do exercise, which then not only affects your body, but it affects your mind. So they're all linked, and we need to look at how they influence each other. Next slide, please. Now, we spoke about what depression is, how it may affect us. Now, what can we do to help ourselves? So psychological therapy, so you go to a psychologist. There are many, many different types of therapy. And often I hear people saying, well, I don't need to see a psychologist. I'm not crazy. Depression does not make you crazy. The word crazy is used in the wrong context. But these talking therapies basically try to ease your burden and help you develop positive coping strategies. So let's take cognitive behavioral therapy, or CBT as it's currently commonly known. It is used to change your behavior and attitudes by focusing on thoughts, images, beliefs, and attitudes that a person holds. So something called cognitive processes. And then we look at how these processes relate to the way that the person behaves as a way of dealing with emotional problems. So for example, if somebody annoys me, instead of me saying, well, they're annoying and this is going to affect my whole day, I in turn look at that and think, well, you know what, maybe why am I annoyed about this? Maybe they had a really difficult day and that's why they did this. It's not a personal attack, it's that they are also feeling sad. So I try not to take it personally. So you look at how you examine your thoughts and then change them in a more positive way. Then we have something called motivational interviewing, which is one of my favorite things. And this is used to prompt people and to motivate them to change a specific negative behavior. So it's not like you're coming down on them and saying, well, you know what, you're not taking your iron chelation, but you need to. It's more of going through and exploring ways in which to understand why they're not taking their iron chelation, but it also motivates them to see that they're not doing it and change it for themselves, so that you're not forcing any behavior change on them. They're coming to these conclusions to them by themselves. Acceptance and commitment therapy is something that is quite commonly used as well to treat things like depression and chronic pain. And it's very sort of similar to mindfulness, where you try to focus on your thoughts that you have at the moment. There's a lot of distraction therapy, and they're all very kind of successful in helping people cope better with chronic illnesses. And person-centered care or therapy is sort of a humanistic approach that deals with ways in which individuals perceive themselves consciously, rather than how psychologists or therapists can interpret their unconscious behaviors or thoughts, like what we see with Freud, which I'm sure everybody's very familiar with. So this is more of an approach where they allow you to talk about your problems and draw your own conclusions. So it's very sort of hands-off, but creates sort of a very safe space for you to speak. Next slide. So what can we do? So we spoke about behavioral. So there's behavioral interventions where you try to create things that will help you change your current situation. So for example, I had a problem when I was a teenager of trying to remember to take my medication. I'd forget one of the doses. I didn't know what to do. And that's when I started setting timers on my watches and my phones that remind me 3 times a day that I need to take a certain medication, or at this time I need to take this or do this or whatever. Those are sorts of some of the types of behavioral change interventions that you can have. These things are created based on you. So it's not sort of a one size fit all therapy. You have things like mindfulness, relaxation. So you can go onto YouTube, listen to some of these relaxing music, try to meditate, just to self-soothe. Because sometimes when you listen to this, you'll start thinking about how you feel, and then you start processing those things a little bit better, because you give your body this time to recuperate. And now with our busy lives, we don't have much time to do these things for ourselves. Then there are things like stress management, where you try to be, and I had a problem with this because I'd leave everything to the last minute and then be very stressed out because I was trying to do a million things at once. I had to learn to pace myself and to start earlier. So there's simple things that you can do for yourself. Relaxation. It sounds easy to do this. It's not, but you have to look at things like that you enjoy, taking a bath, listening to music. There's quite a lot of resources out there that we can point you to help you with this. And self-love. And I can't stress the importance of this. People often are their worst critics. They'll tell themselves like, well, you can't do this. You're not attractive. You're not as pretty as this person. You can't sing. You can't. There's a long list. And I think we do need to love ourselves more. We need to appreciate our unique talents, our unique strengths. And, often people look at social media, and I failed to this a few years ago, where I look at everybody else's lives and I think, well, I'm not doing this. They're doing really well and I'm happy for them, but I'm not there. And that's something we need to stop. People really don't show their true selves on social media. They'll show what they think the world wants to see. They don't want you to see them in a weak or vulnerable position. They just want you to see this great made up face, but they don't talk about the struggles that they face. So with social media, we need to be careful. I think we need to be more honest. Say, if you're having a hard day, say, well, you know what, I'm having a hard day. And I remember seeing this image on social media a few years ago, which really helped me. And it was a picture of an apple. And they posted the front picture of the apple, which looked perfect and polished. And when you turned it around, there was a hole with a worm in it. So they were trying to say that, these pictures are not all that it seems. People's lives that you might look into, they're not as great as they appear. They may be going through stress, but they're just very good at hiding it. But it doesn't mean that they're not feeling the same way that you are. So please love yourself more. Next slide, please. Again, these are some of the things that we can do. Self-care is essential, looking after yourself and your well-being, making sure that people don't take advantage of you, saying no when you need to say no, going to bed early. All of these things are self-care. I'm going to speak about well-being and PERMA in the next slide. So I'll tell you more about that then. Developing coping strategies. So during my treatment, I suffered with a lot of pain. And, that was really annoying. It was really getting me down. And I developed things when I realized that the pain was coming and I knew what my thought process was going to be. I started trying to find ways that I can cope. And I started listening to music. I started looking at comedians, anything that I really enjoyed. I made a list of them to make sure that when I did have these low moments, that I would go straight to that and help myself. And they've been really, really great for me. Pick up hobbies. Set goals for yourself. This is really important. You need to set goals, even if it's simple things like, oh, well, today I'm going to go for a walk. By doing this, you're setting your mind up to think, well, I have a purpose, and finding that purpose, albeit it can be small, it can be a huge thing. Like one day I want to be Prime Minister. It's very, very important for your well-being and for your mindset. So I would suggest you do some of these things, and socializing. And now it's all virtual, but it's important to connect with others. Not only will you help them, but you'll be able to share your worries, your concerns. They may tell you stories that may lift your mood. It's very important. Nutrition is one of the key things. You need to look at what you're eating. They say you are what you eat, and it's just as food is like medicine. You have to take care of your body, so you have to eat right. Again, I'm a hypocrite. I have my days where I eat McDonald's. I'm not advocating for that, but it's important that you do take care of yourself. You look after what you eat. Next slide, please. So I wanted to talk about positive psychology and well-being, and this is a relatively newer field in psychology, but it's one of my favorite things. Now, well-being is your own perception and evaluation of your life. What are you thinking? How are you feeling? What do you perceive your interaction to others to be? How are you functioning overall? It's entirely based on your perception. It's not based on your mom's. It's not based on your dad's. It's not based on anybody else but you. Next slide, please. And PERMA. Now, these components are they're components of well-being, and they represent different aspects of your life that you should pay attention to. The more you pay attention to them, the more you will have well-being in your life. Far than often, we usually get consumed into concentrating on one aspect, but we need to focus on all of them to ensure that we get the most out of our lives and enjoy it. So PERMA stands for positive emotions. Positive emotions are things like optimism, love, laughter. There are all these wonderful subjective aspects of our happiness and pleasure. It's very important to our well-being. Engagement. Now, this is being able to function in your life, like slowing down and being present in this moment. Positive relationships. As I said earlier, loneliness is closely linked to depression. So you should have at least one person that you can connect with on a regular basis. Meaning, and this is very similar to what we spoke about before, but it's serving something bigger than yourself. It gives your life a purpose, and helping others also kind of fulfills part of you. So go volunteer at your local thalassemia society, help some of the children, do something that will be inspiring, but will be bigger than yourself. Focus on somebody else. Accomplishment. So this is more like the goals that we spoke about, pursuing goals, feelings of success, and striving to accomplish something bigger for yourself. This really helps with believing more in yourself. So all of these are very important. You can't focus on one, but you have to try to focus on all and make sure that you have a balance between them all. And usually when you're struggling in one area, you need to look out more. You need to understand why you are, and then try to rectify that. So, and for example, you can ask you things like, well, when have I laughed? When last have I connected with someone? And I can tell you, it takes so much power away from that negative feeling when you start looking at these things in a systematic manner. Next slide. So often carers, siblings, loved ones, they get consumed by trying to make sure that life is better for people with thalassemia. And I know there might be some on the call right now, but you need to look at your well-being as well. Yes, it's important for people with thalassemia, but as you're the ones taking care of them and helping them, you need to protect yourself too. So you need to remember to go easier on yourself. Things like self-care is important. Taking time away to relax is important. You need to lose the guilt. Often I hear parents saying, well, I gave my child this gene. In most cases, you didn't know. This is not something that you did deliberately. This is genetic makeup. Thalassemia trait it's believed to be a sign of evolution against malaria. So it's not your fault. And I think we need to lose that guilt. You need to manage your expectations. I think a diagnosis of any sort is quite a scary thing. It changes your life. Things will not be the same as it were with other children or when you were younger. So you need to change your expectations and try to come up with things that fit your child now and your life. You have to make adaptations where necessary. Sometimes you might plan to do something, but health is such an unpredictable thing at times that you will have to change. So give yourself that credit and allowance to do so. And this one is something that I hear all the time. And it really bothers me that parents are not able to connect with each other. You know, you should find out in your center. Some people, like in the UK, they're very isolated. You need to find a network of people, whether you contact your societies or even TIF or any your doctors, they will be able to put you in contact with somebody who you can share some of your concerns with. It's really helpful when you speak to others. And lastly, and I said this before, but you have to look after yourself. Take a half an hour away to regroup, read a book, listen to music, dance in the kitchen, do whatever it takes just to put you at ease. But do practice self-care for yourself. This also helps with your children as they learn from you. The next slide, please. I'm almost there. So these are some of the take-home messages. Ask for help when you need it. Do not suffer in silence. You know, thalassemia is a condition that you can control. You might not be able to control your situation, but you know, taking your iron chelation as prescribed can help you avoid developing further complications. It's all down to you here. And I know my mother said this to me as a child, and it stuck with me all through my life. And she said, I may have passed on thalassemia to you, but anything you get now, like diabetes or whatever, it's because you didn't take your medication. And I have to say it stuck with me. I still listen to that. And every time I feel like, oh, I'll take my pump, I'll do my pump tomorrow, it comes back to me and I get up and I do it right away. You are in control. Nobody else is in control of your health and your well-being. You are. And resilience and strength. So a lot of people, I hear people tell me, they'll say, Roanna, you're very, very strong and I can't be like you. Actually, I don't possess anything that anybody else doesn't have. We all have this ability to fight, to live. That's what we were born to do. You just have to learn how to dig deep within you and find that strength. But you have it. It's innate. And just like, you know, those cosmetic adverts where they're like, maybe you're born with it. You are born with it. Adherence to medication. I would not pretend that it's the easiest thing to do. I hate it. 31 years into it, I still hate it, but I do it because I want to live. So you should not make an excuse. You have to do it. But there are different types of medication, so you can find things that work best for you. And you are rare, you are beautiful. Don't let people tell you that you're not enough. You're more than enough. And lastly, speak up. Learn your rights as a patient. Challenge. If you're not happy with a decision made by doctors or anybody, challenge it. Ask questions. Educate yourself. And if you do need help, please, please don't suffer in silence. Thank you.
Okay, thank you, Roanna, for this presentation. It's really very enjoyable. Now we have some questions and some chats, some notes that some friends have left on the chat as well. So we will sort of try and combine with them. So the first question says, how to deal with thalassaemic major with anxiety, depression, who say they don't want to live?
So that is quite a common thing that I've heard over my time and even felt like that myself at some points. How you deal with it, it depends on how old the person is. But in the first instance, you need to speak to the doctors and the nurses so that you can find psychological help. Because the biggest thing is, it's not really about the thalassemia in some cases, but it's more about what other things that might be happening in their life. So what are their relationships like? What are they in school, education? It's really important when it comes to things like, well, they don't want to live, is because they don't feel like they have a sense of purpose anymore. So I would really suggest that you go to your hospital, your clinicians, and tell them about it so that they can find you professional help.
Okay, the next question is, a female thal major friend wishes to get married to a normal person only and not to a thal. while her intention to get married is very strong but normal, guys aren't interested, and this makes her depressed. How can we address such issues?
So in the first instance, I don't like people saying normal and not normal. Having thalassemia does not make you abnormal. Thalassemia is just part of you. So you are normal, she is normal. I can understand the reservations about people without thalassemia, but I think, and this is something I've experienced with myself, when you hold thalassemia like a crutch, or people react in that way. If you go out with this positive mindset, like, yes, I have thalassemia, I'm in control of my thalassemia, people don't see you as a condition, but they see you as a person that you are. So it's important that she understands her self-worth, the things that she brings to a relationship. And if these guys are not interested in them, then it's their loss. It's not hers. They aren't the right people for her.
Okay, we will take a chat. This is, I mean, maybe you. Okay, the first thought, I think we all need to sort of understand that there are a lot of things that come along with thalassemia. So a lot depends on how we need to embrace or accept the condition. It is natural that with depression also comes denial, where we tend to neglect or reject the fact that one may have depression. Personally, I feel that communication with someone, maybe another patient, can help at times, because there are a lot of things, especially emotions or behavior, that they may be able to connect with. In case if that does not help and things don't seem to be working, there is also no harm in therapy or consulting a counselor. But then again, that depends on individual, or as they say, case to case. So comment.
You're right. It is on the case to case. There's a lot of denial that we do find, and people think and this is especially in young people, they try to deal with the how and now, but they don't look at the future. But I agree with that. I agree with that comment. You should find other patients to connect with. You should find support when you need it. And one of the reasons that I went into psychology in the first place is because I saw that there was a need for it, and I wanted to normalize talking to others. We didn't have this growing up. I felt that it was beneficial. I think every human being, thalassemia, no thalassemia, should have access to therapists or psychologists. But we need to normalize that it's okay to feel sad and it's okay to talk about it.
Okay, this, I mean, it's like it's not the place to answer this question, or this comment, but I will read it anymore. Are there any antidepressants recommended for THAL patients or otherwise? Are some to avoid as thalassemia patients?
So yeah, I don't think we are in the professional capacity to answer a question like that. I would say speak to your doctor, because they will know what works best for you. But I don't deal with, I'm not an expert in medication. I'm more of the psychological therapy kind of girl.
Okay, the next question is, there is a lack of availability of proper field. 1 minute, is that where we are? Now, what is your opinion on how you handle client or thalassemic patient who is in her denial stage? E.g., for example, they are not ready to accept their treatment happily and always refuse to talk about her medication or thalassemia. What is your expert advice in this?
So in a situation like this, we would try to talk about things outside thalassemia, and try to find out about how things in their life, in school, in their family, how things are going there. With denial, they know that they have to have transfusion, so they're not denying that. But I think the inoculation this is where the problem lies. And I did it. I was in that position where I refused to take any medication. And, you know, like iron, for example, is a silent killer. You won't know. People don't know about their skin coloring. So I didn't see the benefit. You should, again, they should be sent to a psychologist. You should speak to their consultants about this. Sometimes putting them with other patients who felt the same way is quite helpful, and they realize that they're not alone. Because, you know, usually in conferences and things, we focus on the good patients. We have these patients that we use as role models so that the other patients look up and say, well, I'm not like them. I'm not doing those things. And that makes them feel very sad. We need to have people that come up and talk about their truth, not just come and paint rainbows and butterflies. So put them onto patients where they can be honest with each other, and please seek professional help. Speak to your doctors, speak to the psychologist.
Okay, the next question is about filters, about the how to start end transfusion and how the proper inserting of injection needle for chelation. I think this we can try and make another webinar for it, but
that's not my area of expertise here.
Yeah, no, I think we will. It's like we will try and make a special webinar about it. We have to think, like, if we can insert it inside a medical webinar, like a professional can come and talk about it, or a nurse, or maybe another patient, another expert patient. We will see how we will handle this. And there is few cell patient adults feel it's better to undergo bone marrow transplant even after knowing that the chance of success is zero, but they don't want to live the life of constant transfusion. Is this approach right? What is your message for them?
I can't say what's right and wrong for anybody in particular. I can only say what's right and wrong for myself. So if that's how they feel, that should be explored, but we all know our own truths, and we have to try not to say what's right and wrong for anybody else. I know my personal view on that, but it doesn't mean that it's right. So it's very subjective. So I don't really have an opinion.
Okay, it's like, if I may add something, but here he says, after knowing that the chance of success is zero, but they don't want to live the life of constant transfusion. Well, okay, I mean, if they are sure that the success rate is zero, I think they want to think about the hassle, about the kind of life they want to live after the BMT, because sometimes an unsuccessful BMT can be very more troublesome than just having a thalassemia and doing transfusions. So he has to think really seriously about this.
But also, I think it's also a call for help, because saying, like, you just reread it to me and then I listened to the other side of it. But even if there's no chance, that person, I think, is suffering with some sort of depression, and saying things like that, they may have stuff like suicidal thoughts ideas, and it doesn't mean that they're going to do it, but they're just looking for a way to be out. I think this is something that, again, they need to speak to somebody in a professional sense, because it's very important. But that is a cry for help, and they need to be supported, because they are going through a lot. To say something like, well, I'll do this with a 0% chance of it working.
Okay, the next question is taking psychiatry medicines okay?
Again, it is what works for you. It depends on what you're taking them for. Like I said earlier in the presentation, some causes of depression are believed to be biochemical imbalances. So you may need prescriptive medication for that. My philosophy is that you do need to talk about some of the things that you go through. So it's not a right or wrong answer. It's what's right for you. I would do both if I had to, and if it was prescribed. We try not to let patients go on medication unless it's a real need. But it depends on what form of medication you're taking and why.
Okay, the next question is, okay. It is difficult to find a psychologist who understands the disease. If they know the disease, they can help better. But what if there is no one is specialized in this disease?
So every psychologist, they go through different kinds of training. So they might not have any experience in thalassemia, but they might have other chronic conditions, and they're all very closely linked. I know how frustrating it is where you find somebody and they don't understand the clinician, but perhaps this is something that they advise them to perhaps read about and learn about the issues. But psychologists are trained in many different long-term conditions, so they should be able to, they should be educated enough and motivated enough to try to learn more about the condition. If not, you can educate them. I think they welcome, and at least I know my supervisors, when they didn't know about thalassemia, they knew more about sickle cell. When I took information for them, they were happy about it because it gave them a chance to learn, and people like to learn more. But we have to, I think in the thalassemia community on the whole, we do need to try to influence more people to specialize in thalassemia, not just doctors, but psychologists. Even in the UK, the focus is very much on sickle cell, and thalassemia patients don't get the time, and they're not priority like other conditions. And it's something that we as a global population, and we need to work on that.
Okay, now the fear of death is the big problem. Many patients are dying without getting proper treatment. How can we overcome this major problem without the support of ruling authority and medical community?
I think this is where TIF works really well with this, because they go into the countries and they sort of force the government to take to understand the importance of this. Not only should you leave it to the responsibility of others, but this is where you can champion your own cause. You know, now in the day of social media, it's incredible to see how things go viral. Link up with other societies who have done this before, try to get some of their ideas, and then try to work with them and collaborate. They may be able to share some things that worked for them with social media. Like in the UK, we found members of parliament who had people in their constituent with thalassemia, and a number of them. And we made each patient send them emails, which then they had to, by law, they had to champion the cause of thalassemia because their constituents were asking. So there's lots of ways that you could try to implement power in different ways. And once you get one of these MPs or somebody championing the cause, they really go out and support you, and they have incredible ideas. The other thing is to try to target celebrities. We have been messaging them on Instagram, get patrons. Again, people listen to celebrities, the people with a big voice and a big following. But as a global population, we need to work together a lot more than we currently do, and we need to support each other. But we also can't wait for everybody else to do things, and we have to stand and do it ourselves.
Okay, the next question. I am 49-year-old female with thalassemia, going through menopause and suffering with anger and feeling unable to cope on HRT, but struggling with emotions. Any advice?
So menopause is one of the most difficult things that I've ever seen people have to deal with. And you go from all these changes in hormones, you have to find a medium that works for you. There's quite a lot of things happening to your physical body that you do need to take care of. And for your mind, we need to figure out why you're angry, what are you reacting to, and you need to spend more time trying to relax in a way that you can find soothing situations. and try distracting yourself and focusing on other things. But often there's so much you could do when it comes to this. And I think this is where the chemical imbalances, again, go to a psychologist here, or your clinician and ask. Maybe they may be able to prescribe something or recommend you to, or refer you to a psychologist to help you deal with these emotions. You can find, one of the things that I found helpful was trying to document my emotions. So I had this kind of gratitude diary, and I'd write things I was grateful for and write things that make me really upset. And then I would leave it alone for about a month and go back and read them. And you see how much you learn when you start writing down these feelings.
Okay, the next one. Why there are mood swings in thalassemics?
Why are there mood swings? Why does every human being have mood swings? Our lives are really, again, we don't have to blame the condition for this. I think we could blame our existence as humans. We go through quite a lot of things. Like today, somebody cut you off in traffic, and that gets very annoying. We allow people to affect our moods, and people will say things like, well, you made me angry. Actually, the anger came from me. You might have done something. So I think we need to look at how we view some situations, like, the glass is half full and half empty scenario. It's how you look at it. So for mood swings, you need to try to change your perspective. I heard a lot of people during COVID saying, well, I'm stuck at home. And they were very sad and angry about that. You weren't stuck at home. You were safe at home. Sometimes changing your perspective and how you view the world affects your mood. So if you think in a negative manner, you will attract that feeling within. Try to change the situation up. If somebody annoys you, say, try to figure out, well, did they act this way because they had a hard day or they're having something at home? Why did they act like this? Give them the chance. Give them the chance to react that. And the other thing, hormones can alter moods. Conditions could alter moods. So it's best to talk to your doctors here.
Okay, there is a question that was posted on Facebook, and it says, and if we think that we are originals, special and unique because we are thalassemics, is it a positive thought?
Every human, again, and I will go here with saying every human being is special and unique. Don't use thalassemia. I think if you think of yourself as unique, special, in a positive way and not in that way where they use those kind of colons, it will always be it will always be a good thing. Any way that you think of yourself in a high positive way is a great thing, but don't use it in unique and special and be it in a derogatory way or kind of self-depreciation way, because that's not good.
Okay, in 10 major patients, we saw anger issues and demotivation towards life. As a paramedic, how can we help them?
Sometimes people react that way because of the experience they've had with others. So it might not be because of you, but it might be because, somebody else that they dealt with didn't listen to them, didn't hear them. But if you show them this compassion and care, and you show that you're listening to them and understand some of the things, the dynamics change. The anger drops. They don't feel they don't feel the need to try to protect themselves, but instead they allow you to help them. So sometimes people just need you to show them some kind of compassion or say something that they know that you understand and you care.
Okay, we can take only 2 more questions. I will skip this one that's asked about sleeping late at night, if it helps hemoglobin to fall or not, because I think it needs a professional. We can try and post it on when there is a webinar on, on hemoglobin, when there is something about transfusions like so. So we will come to the next question. What do you say to a parent who set boundaries when we already have patients who ran marathons and skydive?
So first of all, I'm very proud of Gabriel for running those marathons. But for parents like that, I think what parents do, and bless them, they try to protect them. They know their child has a condition and they try to protect them and make sure they're safe. And so they set these boundaries to make sure that they stay well and safe and healthy as possible. Now, the problem with that is that they do affect the quality of life of the people, because you have to allow people to go out and live their lives. Like, the point of them having blood and the point of them taking their treatment and the point of the parents sacrificing their lives is for them to go out and live and enjoy life like every other human being. So for parents, we need to educate them more. We need to let them know that it's okay. And even if, something bad happens, that you should be able to fix it, just like with any other child. But you can understand why there's an overprotection and why there's so many boundaries. But we need to educate people more so that they understand what they're doing and how this can affect the long-term quality of life of their children.
Okay, this is, okay, I'll try and read it as it is. I have a problem of short height and weight. Despite this, I've completed my master's and doing my job. My actual problem arises when people treat me as a child in office. Keeps dancing. Okay, my actual problem arises when people treat me as a child in office or in other public premises in front of my partner. She is very supportive, but these behaviors of people made me depressed. I have bipolar disorder, mood swings. Now I could not be normal or closer to my partner.
So those are some of the things. Looking younger and being treated as a child are things that even I have had, and I know a lot. It's quite a lot of our people with thalassemia have suffered that. And one of the things I had to do, because I remember even going to university and they were telling me that the high school taster day was down the hall and that I shouldn't have been there. I made it a point to sit with the lecturers and say, listen, I really, this upsets me. And I'd really not like to be spoken to like in this way as a child. As for the general public, it's that has also happened to me. And I even had partners where they thought that they were my dad. There's not much we could do with the general public. It annoys us. But what happens now is that I kind of laugh about it. And I think, well, if anything, they're like a sugar daddy, and then you have to change your attitude. You can't change the general public. We can try to educate them, but I think you have to try to accept what's happening. You look younger, and see it as a blessing and as a joke. But I know how frustrating it is, and I'm sure many people have. But in terms of your employment and your job, you have the right to speak to them and tell them that, you know what, this makes me very uncomfortable and I don't appreciate it.
Okay, there are on the chat, there are several notes like thanking you, Roanna, and praising your presentation. They loved it very much. But I have to take one or two more questions if you can answer them in short. One that says, how can we overcome the fear of being left alone?
How can you overcome the fear of being left alone? You need to ensure that you keep your circle with your friends. Don't isolate yourself. A lot of these problems come because you worry about it and then you start pulling away. You're responsible for your interaction with others. So please continue to message your social groups, talk to them. This is a problem that you have to make sure that you stay connected. Stay connected with people with thalassemia. Stay connected with any and everybody.
Okay, the last question, and I've over exceeded the time, which says can hormones be a factor in mood swings? well, he put it in the sort of like a note, like a, I don't know, like a,
So hormones can affect mood swings, and this is why I said earlier that you should speak to your doctors, because they are the ones that are, they're professionals in this field and in the concept, so they will be able to help you with that. But please, as the last message, if you do have any sort of uncomfortable feelings or any challenges and difficult feelings, like, please get help, please tell somebody, and don't ignore them and sit and suffer in silence.
okay, now, Roanna, thank you very much on my behalf, on behalf of the TPC. We have really enjoyed this presentation. It's really wonderful. And I hope that you can read the chats, because there are many notes, many comments praising your presentation and praising your attention, praising you, the way you presented it. You have to read the chats.
I will try my best to read them. But
Okay,
thank you for having me. Thank you for having me, Anton. And I think it's really great that you're trying to cover these things that we, like the medical field, neglected for so many years, because it's very important.
Okay, thank you very much, Roanna. Thank you, everybody. And I hope we will see you very soon in another presentation by somebody else.
Bye.
Somebody as good, I mean.
There's lots.
Okay, I said somebody as good. Okay, thank you. Bye, everybody.
Bye.
And